So finally, it's a great pleasure for me to introduce our speaker today, Frankie Peterson, who will present Understand the Childcare Licensing Regulations. She's with the SCDSS Office of Childcare Licensing. And Frankie, if you want to take it away.
Okay, let me start sharing my screen. Oh, Chris, it's doing something. Uh-oh.
Just let me know if you need any help with anything with screen sharing.
It's like my screen started freezing up on me.
Oh no. Okay.
Wait a minute. Let me see. I think I did something.
Yep. I'll just stay here until we get everything sorted out, and I'm just gonna turn off my mic and stuff then. But let me know if I can be of any help before.
Okay. I have it on my screen to share, but for some reason, there we go.
Oh, perfect.
So thank you, Chris, for the introduction. Good morning, everyone. And thank you for your assistance. This is a new platform for me. I've done some virtual before, but I appreciate your patience. And for the audience, please I appreciate your time for coming in to get an overview of understanding the regulations. I would also like to thank the South Carolina First Steps and the South Carolina Early Childhood Advisory Council for the opportunity to participate in this year's conference. So let's get started. Childcare license is under the Division of Early Care and Education at the Department of Social Services. Our director is Cynthia Lara, and our division director is Michelle Bauer. We have 4 regional offices that covers the state of South Carolina, the upstate located in Greenville, our Midlands region is located in Richland County, Columbia. Our Low Country region is located in Charleston, and our PD community region is located in Florence, South Carolina. We do have our fire chief, Kitty Smith. He is in the central office, but he is housed out of our upstate regional office in Greenville. So childcare license is the foundation for childcare in South Carolina. We ensure that children are safe while they're in childcare. And so today, I will be giving you an overview of the regulations and provide you with some important information as it relates to the health and safety of children. So the purpose of the regulations, they were written to establish requirements for the protection of children while in care. You're going to hear me say that over and over again because that's our main focus. The regulation also provides a foundation to ensure a safe and quality setting for children while they're away from home. And it also ensures a nurturing environment for children so they can grow, learn, and thrive. So, Frankie, I'm sure you're asking, who gives you the right to or the authority to go out and monitor child care facilities? Well, DSS, the South Carolina Licensing Law, Title 63, Chapter 13, gives the Department of Social Services the authority to enforce these regulations to ensure children are safe while away from their homes. These statutes also establish a state advisory committee who writes and reviews and make changes to the existing regulation and the suggested standards. The advisory committee consists of 17 members, and they are all appointed by the governor. 5 are parents of children receiving care, 8 are owners and operators of child care facilities. 1 member represents the educational community of the state. There's a business member that represent from the Chamber of Commerce, I think. They represent the business community. Then there's 2 members that represent church-operated child care facilities. And this information can be found at our website at scchildcare.org under Laws, Regulations, and Policy. So there are 4 types of child care facilities in South Carolina. We have center-based, we have religious entities that operate, and we call them our faith-based centers. Then we have our group child care homes and our family child care homes. I will review all 4 types this morning, and I will begin with the family child care homes. So persons who operate a family child care home may care for up to 6 children in their home they reside in, and they have the option of being licensed or being registered. The family child care home who elects to be licensed must also follow the law cited suggested standards. These standards are mandatory for licensed family child care home, and they are recommended for the registered family child care homes. So what is a family child care home? The family child care home means a facility within a residence occupied by the operator in which child care is regularly provided for no more than 6 children living in the home and children receiving care who are related to the resident caregiver. However, an occupied residence in which child care is provided only for a child or children related to the resident caregiver, or only for the child or children of one unrelated family of children, or a combination of these children, is not a family child care home. So what are you saying, Frankie? We have a lot of people that calls us and say, I can care for up to 5 and not be licensed. That is not the law. So this means that if a person cares for more than one unrelated family of children in their home, they must be registered or licensed. So for example, I can care for my nieces and nephews, and then I can care for my neighbor's child. I do not have to be licensed because that's one unrelated family of children. But if I have a friend who would like for me to care for her child, then that would be more than one. So then I would have to become licensed with the state of South Carolina. Family child care regulations requires the operator, also requires that the operator and household members and anyone who helps care for the children are required to undergo criminal, abuse and neglect, sex offender background checks. The operator and caregiver also must have 10 hours of training annually before they can register or be licensed. There are other requirements, such as family child care home providers must have a working listed telephone. They must comply with zoning restrictions, which means that some areas may, the maximum children they can have is only 5. So all of it depends on zoning. Again, you can find these regulations for family child care home on our website at scchildcare.org. So let's transition a little bit to the other 3 types of child care regulation, which are licensed centers, faith-based or facilities operated by a religious entity, which we refer to as faith-based. These types have the option of being licensed or registered. If they are registered, they have a set of regulations they must follow. If they choose to be licensed, they will follow the licensed center regulations. And then we have our group childcare home. All of these facilities must comply with zoning approval before we could issue a license. So during this presentation, I'm going to mainly talk about the center regulations and refer to any differences between the faith-based and the groups and the centers. Okay. So the table of content or the regulations content helps readers to locate requirements in a simpler fashion when you're going through the regulations. The numbers change for each facility type. For example, faith-based facility numbers may be 114, 520, 521, 522, so on and so forth. Excuse me, a group childcare home numbers would be 114, 510, 512, 513. You get the picture. So within these guidelines, they start off with the general provisions, and that gives the purpose for the regulation and who must be licensed and the access to the facility. The definition provides a language for us so that we can both speak on the same, with the same meaning in the same terms, such as when we're talking about child to staff ratio, what does that mean? When we're talking about supervision, ages of children, like what do we define as an infant, 0 to 12 months old, who should be an emergency person, what do we mean when we say volunteers? So all of that is located in the definition portion of the regulations. The procedure portion, or section 114, 502, 522, and 512, gives guidance on the requirements for becoming licensed. It also talks about DSS inspections and monitoring and things that would affect the license, like changes in ownership, changes to the director. So that is all in our procedure portion of the regulations 114, 502. So I want to talk a little bit and give a little bit more of management, administration, and staffing. So under this section of the regulations, all facilities must display their permit in a public area of the facility. The permit will show the issuance and expiration date, as well as capacity, which is the number of children, including infants, that are allowed in the facility at one time. All childcare providers and persons who work in childcare facilities are required to report any suspected child abuse to the Department of Social Services. This means that all staff that work in a childcare facility, including secretaries, janitors, cooks, are considered mandated reporters. All reports are handled anonymously, and they can be made at 188 227 3487. That's 188 Care for Us. And this is a 24/7 hotline that persons can call to report any suspected child abuse. So suspected child abuse means you have a feeling, there's some things that seems out of place, and you would like for us to look into it. The law sets the determination of what would be considered abuse or neglect. So that's why we would like for you to report it. It's allegations until that case is investigated and determined to be founded. We also ask that providers who work in childcare facilities or childcare centers, they can also report it to the regional office, and the regional office will ensure that those reports are handled appropriately. Facilities um, are also required to report incidents to the department and must notify parents immediately. These incidents in the regulations are as follows. When a death of a child occurs, a death of a child or a staff that occurs at the facility um, must be reported to the parent immediately and to the Department of Social Service, our regional office, immediately. When children are left unattended in a vehicle, on the bus, missing from the premises, left on the playground alone, and unfortunately, we've had some that have been left at field trips, at the park, at the skating rink. Those incidents have to be reported to us immediately. Any injuries or accident requiring professional emergency medical treatment, any major structure damage such as roof caving in, electrical fires, um, must be reported. Natural or man-made disasters such as flooding from hurricanes or tree falling on the facility due to lightning must be reported immediately. Facilities are required also to report charges or convictions against the director, the owner, or the staff. Reports of alleged abuse involving the owner, the director, or the staff must be reported to us. Any occurrences requiring the police or fire department that affects the health and safety of children. For example, um, the facility is notified by the police that they have to lock down the facility. Perhaps, I know this happens a lot in Colombia, if a prisoner escape or they're looking for someone that is an imminent danger to or threat the community, those have to be reported. Parents need to be notified, and our office should be notified as well. Um, Facilities must also, within 48 hours, report any injuries that occurred at the facility that a child may have to seek medical treatment, like go to the doctor. Um, it may not be emergency where the ambulance is called, but the child was injured and they have to go and seek their physician or urgent care. They must contact our office within 48 hours. Also, any communicable diseases that are listed on the school exclusion list, the DHEC school exclusion list. DHEC has a school exclusion that has certain communicable diseases that would exclude someone from attending. They have to report those to DHEC, but they also have to notify us within 48 hours. So under this section, you see where it says parent access and communications. In licensed centers and in group childcare homes, parents have the freedom to fully access their children. Their access cannot disrupt the classroom or other ongoing activities. However, the faith-based facilities does not have this requirement and restrictions may be set. So this section also stipulates policies. Parents and staff who work in the child care facility must be provided the facility's handbook. The regulation states that parents and staff must read, understand all policies related to the facility, and then sign an agreement, and the agreement must be kept on file and updated annually or as changes occurs to their policies. The policies must include, but not limited to, the release of children, program schedules, immunization requirements, administering medication, as well as discipline and behavior management of children. And I want you all to be aware that the licensed centers have a no corporal punishment regulation and cannot be administered even if the parents request it. This section also includes, as you can see, children and staff records. These files must be maintained in a confidential manner on site. Um, and it also includes confidentiality of records and children's identity. So children's photos cannot be posted in the facility or used on publications or on their website or any social media without the written consent of parents. They must give their permission before a child's picture is posted. Under this section of the regulation as well, um, gives the requirement and qualifications for center directors, co-directors, teachers, caregivers, and staff are listed. Any staff who directly cares for children must have the required educational diploma or degree with experience, criminal, sex offender, abuse and neglect background checks before beginning to work with children. They also have health requirements that they must meet that we're going to talk about in another section of the regulations. Professional development is also in this section. Each staff, including the director, must have professional training that is set in the regulations. The director must have 20 hours a year, and caregivers must have 15 hours of training a year. The training also include bloodborne pathogen training, which is an annual training that has to be done for the director and staff. In a registered faith-based facility, the requirements are the same, 20 hours for the director and 15 hours for staff. The group childcare home operator must have 15 hours of training, and their staff must have 10 hours of training. And again, we talked about the family childcare home. They must have at least 10 hours of training annually. All facility types, with the exception of registered family childcare homes, must have at least one person who is certified in pediatric first aid and CPR and must be present at the facility during the hours of operation. Licensed centers recommend that a person with CPR and first aid be placed in the infant room and or where children are eating. Supervision. Supervision is a section that we really try to train our providers on because that can lead to serious threat of harm to children who are unsupervised. So directly supervised mean in the same room, within sight, and able to intervene if necessary. Children must be supervised by a qualified caregiver. That means those list of items that I talked about earlier, that is required education, sex offender, background checks, criminal, and abuse and neglect, excuse me, background checks must be done and favorable in order to qualify as a qualified caregiver. Under this section, it stipulates ratios. It explains that the facility must have a procedure that tracks children when they are account for children, when they enter the building, when they exit the building, when they move to different locations within or around the building, when they exit or enter the vehicle. So they must have a procedure, and they must implement this procedure to ensure that children are not only directly supervised, but they are tracked. Children who should never be alone with a volunteer for any reason, not even to open the door for a specialist or a parent. Staff to child ratio must be maintained at all times. Now, in the bathroom, privacy in the bathrooms are given to children 3 years old and older. However, caregivers must be available to assist if needed. If a child is sick, So if they have a single bathroom and the caregiver needs to check to make sure no one else is using that bathroom, that child 3 years old and older can use that bathroom, but the caregiver needs to stay readily there in order to assist the child if they need it, or when the child is finished, they can escort the child back to the classroom, playground, or whatever area is needed. Nap time ratios is under this supervision. It talks about how to apply nap time ratios. And nap time ratios is only can only apply when another staff is readily available. This means that they are near, cannot be in another building on the premises, they can't be on another hallway, they have to be readily available to assist. So now under the section for health and sanitation and safety, there's a lot of things that are discussed, such as child's health and sanitation, cleaning of toys, making sure they're sanitized, especially for children who mouths touch those toys for those babies. So they have to be sanitized daily to ensure that germs are not spread. Emergency medical plan is in this section. Medication procedures that talks about what should be done if a child is given the wrong medicine, how medicine should be logged and stored for safety reasons. First aid kit is in this section, as well as diapering. We do have a section that talks about infant and toddler. However, diapering is under this section due to the health and sanitation requirements that are needed. Staff health is under this section, the requirements for them to have a health assessment done, that they must have TB done. So this section has a lot of information regarding health and sanitation. Public safety and our fire codes are here, emergency preparedness, and what is required to transport children from and to the facility. This section of the regulation is only in the center regulations and group childcare home regulations. In this section, facilities must meet the requirements for program activities, which means they must have a daily activity schedule for all children. This schedule must be written and followed and includes age-appropriate activities in accordance with children's developmentally levels, such as story time, music, arts, cooking, puzzles, blocks, etc. All children must be given the opportunity for outdoor play, weather permits. We've already received calls regarding the cold weather that happened last week. And so children still, because South Carolina is a 4-season state, we kind of experience all spring, summer, fall, and winter. We still want kids to have an opportunity to go outside. So the regulation states that they must take caution when taking children out in temperatures, below 30. Once it gets below 20, they're saying the caution must be taken. So we look for if children have on their coats, their hats, mittens if need be, and then in the winter, are they given an opportunity to hydrate by giving them water or not staying out for long periods of time when the index or the temperature reaches 95 or more. This section also discussed discipline and behavior management requirements. Staff must sign and parents must sign the discipline policy. Staff should be friendly and never harsh or violent to children. Again, for licensed centers, no corporal punishment is allowed under any circumstances. Staff should know and understand the appropriate policies for discipline in accordance with each child's age. So we have physical site. This section of the regulation addresses what is required to maintain a relatively free, hazard-free, and safe environment for children. The requirement notes in this section provides guidance to basic health and safety requirements. The department must be notified if a facility is without water or heating and cooling during the time that they're open. If the water or the cooling heating cannot be restored within 4 hours, the facility must close. Children love to play outside. Because of the freedom of running around on the playground and the need for physical activity as a part of developmental stages, but there are some precautions that has to be taken to avoid any injuries. Child care facility must have a checklist in place regarding the specific safety conditions of the playground area and equipment. Toys and equipment must be for commercial use only and in compliance with the Consumer Product Safety Commission. You can visit www.cpsc.gov for more information or questions about any toys or equipment used at the facility. (114) 508 518 520 and 28 discuss meal requirements. Children or centers that provide snacks and meals must follow the USDA Child Care Food Program guidelines. Daily meals must be posted and dated and in public view and served. The meals that they posted must be served and posted so that parents who may want to have a different choice can make that choice. Foods such as hot dogs, grapes, hard candies, nuts, or popcorn could prove to be a choking hazard and must not be given to children under 4 years of age. Or it must be cut to prevent choking. And all foods must be clean, wholesome, unspoiled, free from contamination, properly labeled, and safe for human consumption. Which means if our staff go into a facility or if we get a complaint or a call from the community stating that a facility is serving spoiled milk, we go in and we look at the expiration date. I know some people may say, oh, that milk is not spoiled. We will not be testing milk or drinking milk to test to see if it's spoiled or not. We rely on the manufacturer's expiration label to determine if something is spoiled or wholesome or free from contamination. So please make sure that if you have milk, you have to serve it, and you cannot serve expired milk or any foods to children. In the event that a parent forgets to bring their child's food, the facility must have nutritional food and drinks for that child. And alternatives must be available for children with allergies or religious belief, such as pork. Sometimes that's the more common things for religious beliefs, and peanuts. But that's not all. I mean, you have other religious beliefs or allergies such as egg, wheat, flour. Most times, parents may note this and it's in the child's record, but all facilities must be aware of those child's allergies to prevent any harm to the child. The last section of the regulation is 114, 509, 519, and 529. And it is the infant toddler, the care for mildly ill, and night care. 3 parts to this section. The licensed centers requires that infants be placed on their backs to sleep. Pillows and stuffed animals should never be used to put children to sleep, or place nothing in the crib to help decrease the risk of SIDS. This section also provides guidance for crib standards, and it should be in your packet of information. All cribs must be in compliance with the CPSC and must have a certificate of compliance in order to be used in child care facilities. You can also visit www.cpsc.gov for more information. Fire codes requires that infants have a designated room if that facility is not deemed as a I-4 by the fire marshal. Children must remain in those classrooms and cannot leave those rooms unless they are leaving for the day or going out for play. These rooms are designated as infant rooms because they have a direct exit from the facility, from the building, that has a ramp that can safely get our little ones who cannot walk out of the building in case of a fire. Facilities can also choose to care for mildly ill children. If they do, they must meet the requirements under this section, which means parents' notification, policies and procedures of what to do, how will they administer medication. So all of that has to be explained, and parents must sign off on it in order for a facility to care for mildly ill children. Night care is under this section. The requirements for staff to child ratio, they must have unannounced emergency drill during these times, sleep equipment, bedtime, bathing, and night clothes. We have had a lot of people call us about night care. One of the requirements is that each child must have its own bed. And so there's not many, if all any, night time care facilities that we monitor. So I thank you for your time. And if you have any questions, Chris, if there's any questions in the chat that you would like to share, and I will try to answer them as best to my ability. If I can't, I will get your information and get back with you. You can feel free to contact me at our office, 803-898-9020. If you have any questions after you leave the conference and want more information. And as always, you can visit our website at www.scchildcare.org to get all the latest information on COVID, latest information about grants, and information about regulations that we talked about today.